News Talk Sports for the Triad WSJS. I'm Jeffrey Griffin. It is 7 minutes after 9 o'clock alongside Christian Snyder. It's a Medicare Monday on a Medical Monday with John Dunn from HealthTeam Advantage. Welcome back, my friend.
Thank you, Jeffrey. It's great to be back.
And John will be here and get you pointed in the right direction, or at least you can share some wisdom with us on where to start your adventure to learn more, right?
That's right, Jeffrey. So, we get these questions a lot. Hey, John, I'd like to think about retirement in a couple of months. What do I need to do? Well, the first step is they're going to get automatically enrolled in Medicare Part A. They need to take the initiative to enroll in Part B. That's key because before you can go into any other type of health plan, you have to have Parts A and B both.
Oh, you have to have that before you can.
Do.
Okay, it's kind of like a prerequisite.
That's right. Both of those make up original Medicare.
Okay. So, and John, when you talk about what's new to Medicare, there are a few different ways, avenues that people might find themselves in the Medicare family now. So let's talk about that for a second, because maybe some of us just don't know. So obviously, the easiest, most direct way that's going to hit most of us is age.
That's what we all think about when we hear Medicare is, okay, I'm about to turn 65. Right. Medicare is going to kick in for me.
Sure.
But there's a whole nother group of people that qualify who aren't 65. And those are people with some chronic health conditions. So if you have end-stage renal disease or you have ALS, Lou Gehrig's disease, both of those will qualify you for Medicare regardless of your age. Then also, Jeffrey, under 65 people could also be on disability. And if you've been on disability for 24 months, that automatically qualifies you to be eligible.
Regardless of age.
Regardless of age.
Okay. Now, when you talk about people doing the 65, some people are not done working when they hit 65. They soldier on, maybe for years or months, or maybe it's even weeks. But what about those folks? How do they make that transition from I'm 65 and working, now I want to be 65 and retired? Right. So what do they need to look at?
Okay, so the biggest thing they need to look at is a little planning ahead. And I tell people, when you are 3 months before you plan to retire, go ahead and start initiating that Part B coverage. You can set it up to not deduct that premium until you retire. Okay. But start that process 3 months ahead of time.
Now, how do people go about doing that, John? I mean, where do they what's the website to visit, or what's the office to call? Yep. Who do they reach out to?
You start all of that through Social Security.
Okay.
So you can either go to the office, and Greensboro, Winston-Salem both have a Social Security office. You can go in person and do that. You can just set up your account at socialsecurity.gov online.
Okay.
And request your Part B to go into effect on a certain date.
Now, what about, and sometimes you hear this, folks who have been working, they say, well, I'm not sure because I had health insurance through my employer, when I was working. How do I cause that to cease and then Medicare pick up without any lapse of coverage? So I don't want a day in there, and that's the day I fall down. That's the day I get in a car wreck. So how do you navigate and segue from one to the other?
Like we've been talking about, this takes a little bit of planning ahead of time. It's not something you want to try to tackle 2 weeks out from retiring.
Okay.
So, as you are setting up everything with Social Security for your Part A and Part B, you also want to be talking to your Human Resources Department at your employer. So you can coincide those dates of coverage ending on your employer group coverage and your Medicare starting. And while we're on group coverage, let me just cover this real quick, because I've run into a lot of people here lately that for whatever reason, they thought they could retire, and maybe the HR department offered them COBRA coverage.
Okay.
Do not take COBRA coverage if you are retiring, because Medicare does not see that as credible coverage, which will in turn cause a late enrollment penalty.
See, you can only get that kind of stuff right here on Triad today. What can we find at the Medicare website, John?
Okay, so once you are set up with your Social Security and you have your Medicare ID number, that'll be your red, white, and blue card, then you can go to Medicare.gov and set up your online account there. Now, That's important because you're able to look at what different plans are available in your area. You can also see, we've talked about these eligibility periods, whether you're aging in or what is annual enrollment or what is open enrollment. All of those definitions are there. So it's a great resource. You also have posted there your monthly drug usage. So you can try to keep track of those coverage gaps. When am I going to go into the gap? Because all of that's estimated through that website as well.
So what does that mean when somebody's going to go into the gap? Explain that to us.
Okay, so when you start off in your prescription drug plan under Medicare, you have the initial coverage period. You may have a deductible. You may have a plan that doesn't have a deductible. But that's the stage where you have pretty much a low copay for all of your prescriptions. After you and the insurance company have paid so much towards prescription drugs, and that number changes from year to year, then you go into what's called the coverage gap, or as most people know it, the donut hole.
All right.
And that's where you pay 25% of the cost of a drug, whether it's a generic or a name brand. You're responsible for 25% of the cost of that drug.
Okay.
After you've paid so many more dollars for those drugs, then you go into catastrophic coverage and you have extremely low costs for your drugs at that point.
All right, but that can happen. That's not a...
It does, especially with the price of drugs today.
Sure.
It happens more than it used to.
Now, John, you touched on the different enrollment periods, and these also can be a bit confusing because I heard about AEP and OEP and SEP, and I don't know where I am and what's what. So let's make our way through these, and we'll try to get everybody straight so they know where they are and where we're going.
Okay, so annual enrollment period, or AEP, that is that time of October the 15th to December 7th every year where you're able to get into a new health plan, change health plans. I want to come off original Medicare and go into a Medicare Advantage plan. That's the time of the year where you can do all of that. OEP is January 1st to March 31st, and that is if I made a decision I'm not happy with in AEP, I can change it in OEP.
So this is where we are. This is where we are now.
That's right.
We're in the open enrollment period. So if you made a decision, maybe your doctor's changed, you have another need, you've moved to another county.
Got on a new prescription drug.
Yeah, there are all kinds of reasons.
That's right.
But this is kind of a second bite at the apple.
It is.
Explain the whole thing about credible coverage and why that plays a role in the open enrollment period.
Okay, so open enrollment period only has to do with Medicare Advantage. So if you're on a Medicare Advantage plan, if you want to change to another Medicare Advantage plan, you can. So January 1st to March 31st allows movement between Medicare Advantage plans.
Okay.
It does not allow you to move from original Medicare or Medicare supplement to a Medicare Advantage plan.
All right. You can go from one to the other, but not come in the front door.
That's right.
And then SEP stands for Special Enrollment Period.
Special enrollment periods, yes. So these are the enrollment periods that we will use if you move from one area to another. That allow you to look at a new plan. Then we have one going on right now, and it is an emergency SEP. So anytime our governor issues an emergency order, and most of these right now are weather related. So January the 8th, Governor Cooper issued an emergency order for bad weather. That automatically triggers an SEP, which means whatever enrollment period is going on at that time, it could be extended for the emergency order. Now, what makes this one significant is this emergency order that was issued on January the 8th, it will actually end March 31st. So if nothing else was going on, this SEP wouldn't really matter because you have OEP.
Right.
Where this one is important is it overlaps another emergency order from the fall. So we were already under another emergency order that ended on January 31st, which in essence, since it happened in the fall, extended AEP. So if you didn't make a choice in AEP, moving from original Medicare or Medicare supplement to a Medicare Advantage plan, you could have done that in January under the special enrollment period for the executive order.
All right.
Now, since we had a new executive order to come out in January before the previous one expired, it extends that now until March 31st. So if you are a person who did not make a change in AEP,
yes,
and now you want to, you can under that SEP. So unlike most years, this SEP right now will allow you to do what you could have done in the annual enrollment period.
All right. So we've really effectively had annual enrollment from October 15th of 23 to March 31st of 2024.
Yes. Now, if you did make a change during AEP, you wouldn't qualify for this SEP.
Okay.
So it's specifically for those who did not do anything in AEP.
But then you would fall under the OEP, the open enrollment period,
if
you're in an Advantage plan.
If you're in an Advantage plan. But where this is significant is if you're not in an Advantage plan and you want to be.
And you want to be.
Yep.
Now would be the time to make that leap.